Been about a month since hospitals in North Idaho instituted crisis standards of care. The rest of Idaho followed suit about a week later, but unfortunately they're not looking much better in terms of hospitalizations and deaths up north. Kootenai Health in Coeur d'Alene now seeing record high hospitalizations and ICU admissions due to COVID-19. Here's Katya Stepovic.
The day crisis standards of care went into effect at Kootenai Health, the number of patients hospitalized for COVID-19 was 113. 1 month later, and it has already climbed to 150, the highest the hospital has seen.
150 COVID patients is about 75% of our normal pre-COVID bed capacity for med-surg admissions, right? Today we've got 43 critical care level COVID patients and 17 on ventilators. It continues to amaze me how our clinical staff, our support staff, our physicians, our leaders are able to accommodate this surge.
But one way or another, medical staff continue to buckle down and take care of COVID patients, even the additional 10 to 20 of them that are admitted daily.
We've seen a lot of deaths, averaging about one a day in the COVID population. I just spent the last week in the ICU, and it's a very hard place to work right now. The patients are very sick. It's just a constant struggle to take care of these patients on a daily basis.
The COVID positivity rate at Kootenai Health is 27% and continues to climb. To put that into perspective, St. Al's in Boise's positivity rate is 23%. St. Luke's in Boise, 18%.
It's just incredibly difficult to describe what it's like to take care of these patients and be on the floors and see these patients on a daily basis. The volume is unbelievable. The number of patients that are on the verge of being intubated or in times dying is extraordinary.
Because there is limited availability to transfer patients out of state for care, resources are limited.
If you have a different type of job and you don't have the resources to do your job, it may be a construction site and something doesn't show up and a house can't be built. That's frustrating, no doubt. But when you can't care for a patient because you don't have the right resources, it's a human at the other side.
Staff are endlessly tired and the morale dwindling.
When you come into work every single day, you have a day off or some time off and you come back and you think it's going to be better, and it's not.
And the patients who are fighting for their lives have only lived a small portion of it.
What we've had and we've seen is a really struggle from the respiratory therapists and the nurses, and actually the physicians quite a bit as well, is just being able to wrap your head around the amount of patients that we have lost that are in that younger age group.
I think we're going to see a whole population of young people with chronic lung disease. And many of them will need lung transplants.
As much as medical professionals hate to believe it, for them, the light at the end of the tunnel is faint.
The thing that's frustrating for many of us is that a lot of these people don't need to be in the hospital if they were vaccinated.
All right, Katya, we've heard a lot of these frustrations before from healthcare providers and stuff, but what we didn't hear in that story is how many of these record number of patients in Kootenai Health are vaccinated or not.
Yeah, and there's a reason for that. While they tell me a vast majority of the patients in the hospital are not vaccinated, they can't share a specific percentage with us, and there's a reason for that. Like I said, I want you to look at a statement that Kootenai Health sent to us. They say in part, "The reason we aren't sharing this number is because it is manually tracked and too cumbersome for our staff to pull. There was a time when we were sharing this number, but it's not having any impact on changing community behavior and just adding more work for our overburdened staff. So we have stopped providing it." And Brian, if that statement doesn't show you and illustrate just how overwhelmed these medical professionals are, I really don't know what will.
Wow, I mean, it's too hard to keep track and people aren't paying attention to it anyways. It's quite a thing to say. All right, thank you very much, Katya.